Hi, Becca. How are you?
I'm doing great. Thank you.
So you are coming to us from Dr. Raghu Athre's practice in Houston, Texas, and you underwent a facelift at 57,
Yes.
which is right around, right when you're in the thick of it of menopause. So can you tell me a little bit about what made you decide this was the right time for you to get a facelift?
Well, outside didn't match my inside. I kind of have a young spirit and I would just look in the mirror and first thing I would notice is these jowls and my neck and so it was just like I just that's the first thing that I noticed. And I just wanted to feel like myself again. I didn't want to, look any different. I just wanted to look like myself and refreshed.
Yeah. And were you doing anything before that, like facial treatments, non-surgical, lots of skincare?
Well, I've always been into skincare. I'm kind of a skincare junkie, but I've always been into skincare, but more applying skincare. I would get Botox about twice a year, and
Mhm.
that's about it.
And then what areas of concern were really bothering you? Was it mostly the lower face?
I had jowls right here.
Yeah.
My neck, you could see the lines on it. You could see I have had a very hooded eyelids.
Mm.
And my face just wasn't looking as fresh, even with all the products that I was using. And so I had hit menopause and it was really, really taking a toll because I was also scared to use estrogen because I'd had previously had cancer. So I was kind of scared to use my hormones. And so something had to give. I couldn't
Yeah.
just continue down that road.
And what made you choose your particular list of procedures? Because so you've had a neck lift, the facelift, and what else? The
Yes.
upper bleph,
Well, just to be clear, I've had a deep plane
a
facelift.
deep plane.
I had a deep plane neck lift. I had an upper breath. I had a lip lift, and then I had the TCA chemical peel.
Oh, wow. Tell me a little bit about what it was like having everything done at the same time and what your recovery was like.
Well, I did it all under local,
Oh,
and because I had, like I say, I had part of my kidney removed, like just like 3 months prior, so I didn't want to be put under again. So close, being my age, and so I was able to do it all under local.
wow. Everyone says that it's like it feels so tight on that first day. Did you experience that or what were you, was it a lot of pain?
Well, mine, because I had the chemical peel at the same time as everything, I had it was swollen and my face was swollen. And so that was mainly the pain for me. And my jaw was sore right in here. But I didn't really feel, that extra, I didn't
Yeah.
feel like my skin was being pulled like way too much. It was mainly just my jaw was a little sore and on both sides.
And how long how long was recovery before you could, go back outside, walk around and feel like part of the world again?
Well, 6 to 7 days was a turning point. Like,
Okay.
okay, the first 5 days, I was like, what have I done? And then the 6 or 7 days was a turning point, and I could see the light because I was like, oh my God, I'm going to be, messed up. I was really scared. But then I could see the light of the seventh day. And by the 14th day, I was thrilled. I could go out and wear makeup, and it was just great. So it was at the 14th day, you can be around your friends and people are just like, wow, you're looking good. And they didn't really notice that what I had done.
Oh, so
Dr.
they,
Audrey is amazing. Like you can't even see my scars. You
and
see,
are your scars in the front of your ear, behind your ear?
they were right here in the front of my ear. They were behind my ear. He did such an amazing job. And I have very fair skin. And he
Mhm.
just did such an amazing job that you can't even see the scars at all.
What
Or
were
under here.
you, where you have one here?
I have one here.
Yeah, that
he,
looks,
he
you
just
look,
did remarkable on that because that's one thing that you have to worry about when picking a surgeon is sometimes it can make your hairline go back further.
right.
You can always see the scar. I was really worried because I love wearing my hair up, and
Yes.
so I was like, that's going to be a dead giveaway. I guess those days are over, but they're not though. I don't. You can't even see my scars.
You
So
look gorgeous. You look
yeah,
beautiful. And that is a huge concern, right? The incisions, the
yes,
placement, the scar. Was there anything else you were worried about looking
yeah.
unnatural?
I was so scared because, we go to my husband. He's a board of directors on some different places. So we go to a lot of galas, and you look across the room and you see women. It's like you can just tell they've had work, And I was so terrified that I was going to be one of those women. It's like, oh, she's had work. I didn't want that windblown look that just like touched. And I was so terrified of that. And I mean, I'm really so grateful for my doctor because no one ever asked me, have you had a facelift?
Do you feel like you still look like yourself or
100%.
yeah.
100%. Yes.
And the lip lift too is everything looks so natural. Tell me a little bit about that. Is your scar under your
It
nose?
is.
Yeah.
Yep. It's under my nose. And this part was just a lot longer. And so, and with the aging and this jowls, everything was kind of coming down, which made
Yeah.
this even longer. And so it just, helped with the more youthful appearance to do the lip. Thank you. And he also did something on the bottom where he just did this stitch or something. I'm not sure what he did just to make my bottom lip fuller. But he did so many unique things that I really, you know, never heard of, like the bottom lip. I mean, I was wanting a lip lift, but I never heard of doing the bottom lip too. So
Well, you think of a facelift and you think of like taking the entire face and
yeah.
pulling it up and back, but just doing these little tweaks along the areas of concern really do make such a huge difference, I think.
It does. And, doing a facelift when they just pull the skin, that's going to loosen up again. You need to get where they attach the muscles and do the whole muscle also, muscle repair and muscle lift, because that's what Dr. Athre did. And that's what I'm so thrilled about because it lasts longer.
So you said your friends didn't notice. What are people saying to you when you're out in the world?
Okay. I went through a period where I didn't even get noticed. Like I started feeling invisible. And I'm not trying to brag or anything, but I was hot when I was younger and I'd reached a point where I would see, cute guys and stuff, and nobody would notice me or look at me. And now I'm getting looked at by young guys. Don't tell my husband. Like, seriously, I get noticed when I go places and I'm feeling cuter. So I'm dressing cuter. And it's just given me like a total spice on life. Like, I'm having fun now. And before I just kind of falling through the cracks.
I love that. And they do say that, right, during menopause, that it's that feeling where you're kind of feel aged out, like
Yeah. Invisible,
invisible.
literally. Hmm.
Yeah.
Yeah.
So
And
that's wonderful. So this gave you what you were after, which was looking on the outside how you feel on the inside.
yes, yes, yes.
So what do you say to people who say, okay, you should just age gracefully?
That's like torture. I mean, aging gracefully is, I guess, just accepting the jowls and accepting this. But to me, aging gracefully is looking the best you can and
Yeah.
for as long as you can. That's
Yeah.
aging gracefully to me.
And there's no right way to do that, right? So if some people want to, use the tools that are available or get
Yeah,
something fixed that bothers them, to me, that is graceful, you know?
it is.
Yeah.
And feeling good about yourself and feeling confident about yourself, you know, brings out, a side of you that was kind of dormant for a while.
Yeah.
And so, yeah.
Well, you look absolutely beautiful. Do you have any advice for anyone who's considering having facial surgery and they may be on the fence, or maybe they're thinking, I'll just wait until I'm a little bit older. Like it's not my time right now.
I think do it younger so you can enjoy it long. I mean, I honestly, when I went in there, it wasn't looking to turn back the clock. I was looking to build my confidence and to feel like myself again. And that's what Dr. Athre gave me.
Amazing. Well, you look so beautiful. Thank you so much for speaking with us. And I know that this is going to help a lot of people who are on the fence or
Oh, they
think,
should do it. Just do it. And just make sure you go to the right doctor. Look at, the reviews. Ask a lot of questions because going to the right doctor is everything. And it doesn't have to be the most expensive doctor, because sometimes, some of the smaller practices, they kind of, I was the only patient of the day when I went in there.
I think the way that you did it, where it's like the smaller things are also part of your treatment plan. Maybe things you hadn't thought of when you first went in to see him.
Oh, absolutely.
Yeah.
Yes. Yeah. I didn't think about the TC8 pill. I didn't even know about that, or you should do it at the same time. I didn't, I just kind of mentioned my lips and he's like, we can do that. And I was like, oh my gosh. When I left there, I was literally like so excited. And I planned for my surgery 10 days after went in, and I had a whole long list of people to see, surgeons that I had researched. And when I saw Dr. Athre, I just knew. And I'm so glad that I just trusted my gut instinct and was swept with him.
Well, wonderful. Thank you so much. We're so excited to share your story, and we're going to talk to Dr. Athre next.
Okay, thank you so much.
Hi, Dr. Athre. Thank you for joining NewBeauty today.
Thank you so much for having me.
So we just spoke with Becca, and she was so wonderful to walk us through her procedure. And what we were talking about is the perception of a facelift is usually that you're getting everything lifted and pulled up and back. And with her procedure, what I loved is that you targeted all of the individual concerns, some that even she wasn't sure that she had, to create this beautiful result. Can you talk us through that a little bit?
Sure. So I think that there's this common misconception that when someone says, hey, I want to look younger or I want to look rejuvenated, the go-to is we use the word facelift. It's kind of almost like if you say, hey, especially here in the South, the word Coke I want a Coke is synonymous for Coca-Cola, Pepsi, Sprite, Dr. Pepper. I mean, it's
Right.
kind of a lump term. So this is where I really like to I call this full facial rejuvenation. And what that means is look at the patient, look at first of all, what their individual concerns are. That's the first thing. Okay. So what did they see? So I always start the conversation with, you have a magic wand. What would you do? Then, so take that. And then the second part of this is the analysis component. What's happened to this patient? Where has the aging really occurred? Everybody ages a little differently. There's some ethnic and genetic type groups we can probably add to, but everybody's still individualized. And then kind of making this comprehensive list of what I see and how do we reverse each one of those and try to put that all together into a group of a package. So that's what I do probably 99% of the time. And so Becca is a great example of that. And when you can do that and it all comes together, people look like themselves, just more refreshed, younger, and they look natural. You're not changing who they are, just making them look refreshed and enhanced.
Well, also, if she came in and you only addressed her jowls, which seemed to be the major concern that she had, then aren't you still leaving behind a little, other signs of aging that are telling and
Exactly.
they're not meshing well with your work in a sense?
Exactly. So, I tell patients, there's a couple of key things that I tell patients. So first of all, during the consultation, I tell them, hey, listen, I'm going to listen to what you want. And so most patients say, I hate my neck. I really don't like my neck. Okay. This is a very common thing. But if I go and just do a neck lift, hypothetically, I'm going to get a suboptimal result. B, patient's going to be unhappy because then when you show them hey, listen, what it really takes to take you from the train station where you are, which may be 50 or whatever, and pick you up and take you to train station age 35, it really requires this comprehensive look of, hey, your cheeks have fallen as well. We got to address that. There's a little bit of laxity here. Your brow, if we take a look at it, there was probably a little bit of falling of that brow. We need to open your eyes up. So it's looking at each one of these things because at the end of this whole exercise, what we really want is that patient to come back and go, wow, I look amazing. I mentioned this, I think one of my patients, I'd gone this past winter to Italy and Paris. and you go and see the Mona Lisa, okay? Nobody goes in to see the Mona Lisa and says, oh, this is Leonardo's amazing use of depth perception, and she has this half smile. You just go, it's a beautiful lady. That's what you want to do with surgery is you, at the end of the day, you want to go, that's a beautiful result.
Yeah.
It's not a facelift, it's not a neck lift, it's not a lip lift, it's a beautiful result.
Right. So for women who are like Becca, who are in their mid to late 50s, they're experiencing menopause, their skin is changing. Is there anything they should also factor in? Like, I know she had a chemical peel. Was that for skin texture?
Correct. So menopause is this complicated system of things that happen. Okay, and when each woman goes through this, and they find different types of things that are happening to their face. First
Mhm.
of all, there's an overall loss of volume. Okay, this is almost everybody sees this loss of volume, and with that, there's also this kind of the skin looks a little sallow. It's not as plump, so all these different things are going on at the same time. So a couple of real, I think, target areas that we do well is the volume fat transfer. That
Mhm.
really helps. Like the facelift and neck lift really help resuspend the tissues. The deep plane really gives that natural look and resuspends, but you got to add the volume to it. So that volume is really replenishing some of that lost volume. In Becca's specific case, her skin had started to thin a little bit. You were
Mhm.
seeing a lot of the little fine lines in the skin. This is a very common symptom that especially Caucasian women see during that menopausal stage. So the chemical peel was something that we used in her to really kind of target that, thicken up that skin, and give her that smooth complexion.
And she mentioned the deep plane neck lift and facelift. And I know just from, being with NewBeauty and writing about it so much that every surgeon has their own technique and there are several techniques and not one is, best. There's the SMAS technique, there's the deep plane. Why do you prefer the deep plane for your patients?
So, couple of different reasons, and it's a very patient-specific choice as well. So we'll talk about Becca's specific case because why the deep plane really worked in Becca. Number one, when we looked at her aging, so we had a lot of aging in the mid face. So there was some volume loss, but you saw this entire fat pad start falling down with a deep increase, a lot of jowling across the jaw. You really can't get a long-term natural result if you don't use a deep plane technique in that mid-face facial region. So that's you want a natural look. You don't want to just yank on the tissues because that's not going to really last the test of time. So that was the rationale for using the deep plane face technique on Becca. Now in the neck, I pretty much universally use a deep neck technique because almost every woman on the planet, they want a sharp neck. I mean, they don't want an okay neck. This is one of the places, they want a badass neck.
Right.
So that in order to get that kind of really sharp definition, there really isn't a better way to get that definition. It's not something that's possible without using a deep neck technique.
And what about this question of when is the perfect time for facial rejuvenation or a facelift?
So I'm going to answer that question in two separate ways. Okay. First one from the patient perspective. From the patient perspective, you're ready when you're ready. Okay.
Mhm.
So I'm not the kind of doc that says this is the perfect age. And if you cross this age, call me tomorrow. I mean, I don't think that that really works. So patients are ready at their own speed, at their own, je ne sais quoi, everything that's going on with their life and all this kinds of stuff. So that's number one. From a doctor perspective, um, it definitely, in my opinion, I think it's easier and you get better results when a patient kind of has the mild, moderate stage of aging, is healthy overall, active, all that kind of stuff comes in and says, I'd really like to kind of turn that clock back a little bit. I mean, that's a grand slam home run result.
Yeah.
Whereas when you kind of wait, now you're in, say, mid 70s, and then you come in and say, hey, listen, I want to jump from mid 70s to 40. That's
Right.
a harder procedure from the doctor perspective. So I kind of like that. Like Becca was perfect. Like she's healthy, no medical problems. From a mental, psychosocial aspect, she's active, she's doing everything. And then she goes, listen, what I see in the mirror just doesn't reflect how I feel inside. I mean,
Mhm.
that's like, you're setting me up to like hit a grand slam home run.
Well, and then I just have to ask you, with all of the news going on around facelifts and Kris Jenner's rejuvenated face, do you think that that makes it easier for patients to come in and talk about these kinds of things and helps reduce the stigma?
Absolutely. So I think that a lot of the public, there's been a lot of attention on facelifts recently, not just from that perspective, but there's been a lot of buzz on deep plane facelifts. I mean, these are common things that are coming across.
Yeah.
And first of all, there's a lot of education out there. So patients are able to access this information and kind of be able to do their own research, which is awesome. The stigma of doing plastic surgery and all these kinds of things definitely has come down.
Well, thank you so much for your time. I really appreciate it. And you did beautiful work. Becca looks amazing. And we're so happy to share her story.
Well, I really appreciate being on here and the opportunity. So thank you so much.
Thank you.